SPOCK brow. What is it? How is it caused? And is there anything we can do to help it? There are two components which constitute a real, actual SPOCK brow. The first being a medial brow drop, where the middle fibers of your forehead muscles are paralyzed, and as a result, they cannot elevate upwards, and the result is heaviness in the middle like that. The second component of a real SPOCK brow is untreated frontalis movement in the lateral part. This part of your forehead will still be lifting up because these muscles aren't relaxed, and this part of your brow is completely paralyzed and dropped. The result is that classic spocky appearance. How has this been caused? So the fibers in this area, which we should never inject, have been relaxed. Whether that's because they've gone too low when treating the forehead, or they've gone too high when treating the glabella, either way, the result is relaxation of these muscle fibers here at the bottom of the frontalis muscle, and the result is nothing can elevate. So you cannot lift up like so. Finally, not enough toxin has actually been placed in the lateral part of the forehead, which means this muscle is still lifting. Is there anything we can do to help a SPOCK brow, a real SPOCK brow that is? Despite what many people say, if these muscle fibers at the bottom of the frontalis are relaxed along here, there's not an awful lot that can be done to help. You're most likely going to have to wait it out. However, the lateral forehead can definitely be treated. With a few units either side, we can treat the lateral frontalis, so it won't be pulling up as much and you won't have as much of a sharp look in the corner. That is what actually causes a real SPOCK brow. And remember, there's a difference between being slightly spocky and having an actual SPOCK brow, which involves that. Okay? If you found this useful, make sure you save it for your learning and drop me a DM if you have any questions.